Well, friends, welcome to a new session of CBME in biochemistry, and we will be starting the new session with the Saraswati Vanna, as we all do in case of all uh, invocation to the Almighty, that the objective with which we have started this course may be achieved. We start this course. Sujata ma'am, please share screen.
Yes.
We have with us all the new batch. All the Dr. Sujata will be presenting the first session, and we have with us Dr. Nibriti, Dr. Pragna, Dr. Jyoti. Over to you, ma'am.
Thank you so much, Dr. Bedi. Welcome all like-minded biochemists to this group. What we thought today is, I will start my presentation because we've got about 90 odd registrations, and only 43 have joined right now. So maybe they're on the way, and they will join us a little later. So what we intend to do with this course and how we intend to go about it, we will discuss a little later, and also the introductions of all the people who are going to help take this forward along with all of you, we will do after I finish this presentation. I'm not, saying anything. Yes, Sanjay, you wanted to say something?
No.
I'm audible, right?
Yes.
So all of us are aware of this and about CBME curriculum and framework. We're already 1 year into it. So actually what we need to do now is, with this help of this course, consolidate whatever we have done so far and what was good, and also discuss with each other how we can take this forward. So we have the CBME, and we must remember here it is the competency-based medical education curriculum. It is not pure competency curriculum, and that is the reason why we are still in a way sitting in our silos as a biochemist and a microbiologist and a pharmacologist and a physiologist and an anatomist. But at the same time, we are gearing up our students to be becoming competent IMGs. So that is the whole idea. This is the document that came into being in late 2018, 2019, and this is what we've been using so far. So what did this say? It says, can I, yeah, 1 minute, yes. It says that there is a need for wider clinical exposure right from the first MBBS. And that is in fact what led to the ECE. And then there should be more emphasis on skills, attitudes, and communications along with knowledge. We have to make our students lifelong learners. And we have to comply with the World Federation of Medical Education guidelines, as well as the local needs. Why are we saying this? Why are we talking about the World Federation? Because all of us are aware that the USMLE and the US is going to be in a way closed to most of our students if we don't comply and don't get accredited according to the global standards. And that is the reason why we need to use the WFME guidelines, the NAC guidelines, and so many other things, so that we can move forward and our medical colleges are recognized for the work that we are doing. So there have been many educational reforms. In 2008, there were the Platinum Jubilee celebrations, and there was a launching of the faculty development program. Then there was Vision 2015 that came forward, and all of us, there were quite a few of us who were involved in this Vision 2015, where initially we were invited by the MCI to make this document on CBME, and I was one of the teachers involved, along with Molly Jacob from CMC Vellore, who went about putting it together. And then it went on where Nibriti was one of the other people who finally whose document finally saw the light of day. Then there was the graduate medical regulations, followed by the competency pattern that we've seen. And of course, there was the CISP and the university and institutional curriculum. All this was, targeted so that we could get a competent Indian medical graduate, and so that we could see a positive impact on healthcare. Faculty development programs all began in great earnest right from 2009, but it was later on that, with the revised basic courses and the CISPs and everything, all of us have now started getting geared up into setting this all into motion. So the idea, quite a lot of this, if you see the earlier documents, it was all there. However, there was nothing very structured that was there in place. And now we find that this structuring has occurred, and the MCI and the government has tried to bring all of us on one plane and on one page, so that all of us are in a way like-minded, and there is no way in which someone's telling us, oh, why should we do this? It has nothing to do with me. I will go about doing what I used to do all these years. No, people, the in a way, very gracefully, I should say, a change has occurred, and they have seen to it that the reforms have come into play. This was the Gazette, and then it went right up to having everything published in the Gazette, so that there is no two ways about it. And we have now the Indian medical graduate who should possess the requisite knowledge, skills, attitudes, values, and responsiveness, so that he or she may function appropriately and effectively as a physician of first contact to the community while being globally relevant. See how well this whole statement is framed. It talks about the KSA that we have been, trying to drill into ourselves, and then trying to tell our students about it. And they say that they should be ready to face the community. And at the same time, if they were ever to go anywhere outside of India, that they are able to also face the world at large. So in all this, what is the educational role for the learner? It is now people have understood that we're not talking to kindergarten students. We're not talking to school children. We're talking to adults, and we have to then therefore change the way we teach. So here, the learner has to take personal responsibility for learning. They have to adopt self-directed learning methods and demonstrate and document evidence of acquisition of competency. That means they have to be motivated and say, why am I learning? I am learning for myself and for the good of the community around me. So this is the idea, and that is where first year teachers like us come in, where we ingrain the right kind of principles into them, so that ultimately we give the the preparation of the IMG a great boost. So this is the goal, the IMG. What are they saying? They have these 5 roles that are already documented. You know that there are the CanMeds, the CanMeds that is from Canada. Then there is the ACME, American Association, which also has roles written out. And now the Indian medical graduate, we have these roles defined clearly. And if you go through that document that is given to us and read it like a storybook first, you will understand and you will enjoy that whole process, and you will understand what is it in it for us also. So what are the roles? You have the clinician, you have a leader, a good communicator, a lifelong learner, and a professional. So we are moving therefore from subject based competencies to role based competencies in the form of all these 5 roles. And that is the goal that we have to also nurture. This is a slide that I've taken from our CISP workshops, and it tells us about how we can translate the subject specific competencies to global competencies and make an Indian medical graduate. This is our timetable. All of us have gone through it. We started in August in earnest. Foundation course happened, and with all these webinars that are happening, and so many people talking to us, we have made it very clear that when the students come, they come with a certain zest to to go forward and to see something related to medicine. And in August, when they came, a whole month we did nothing but the foundation course. And somewhere most of the teachers have felt that there was this lack of link. And that is why I think all of us have suggested and have been suggesting that if the foundation course is very, very good, it is an extremely good module. And if it is broken down into not just 1 month, but 15 days in the beginning, and then take the other 15 days piecemeal through the year as they start going to the wards for early clinical exposure, and as they start moving on forward, we take some aspects at that time. And that is what is now proposed. But I don't know about the rules and the regulations, and whether small changes or tweaking in this whole timetable, once this gazette is made, are allowed so soon. So we will have to take each year with a pinch of salt. Plus, of course, this pandemic has put things all haywire. There is a recent notification from the MCI which is saying that okay, because the NEET is not going to happen till September, and the results may not be out till October, November. So they have said that we can take the first professional exam anytime up to December. And how to take it, what to do, they are going to let us know at a later date. So we just have to wait and watch. So here we have the first MBBS which is moving on, and we will then the exam was proposed in September, but is now going to move on till November, December, I think. And then this is the rest of the program which all of us are aware of, and the internship. And it is at these levels that the CBME has said that we can integrate. That means the first MBBS student teaching can be integrated with the final year and vice versa. So in terms can have a horizontal integration and a vertical integration. So this is it. You have sort of 1+, so you have about 14 months program as far as the first professional goes. So we have the anatomy, biochemistry, and physiology. We have ECE, and then there is of course the professional development, including ethics. So all this was part of what we have been doing so far, and what we have to now see, how can we change it a little bit or take it forward. As far as the structure is concerned, there is a change in the time span only in the case of forensic medicine as such, and times are allotted in 3 phases, and special dedicated time is allotted to students for self-directed learning. And this is what we would like to discuss with all of you, is how and where to incorporate the ECE and the self-directed learning when we break up into groups and work towards it. So remember, it's not that we are taking a class or anything, it's all of us together who are going to make this CBME biochemistry a success, because we need thoughts from everyone and we need to put it all together for a wholesome bolus of food for thought, so to say. There are many elements to this whole uh, program. We have the newly introduced foundation course. I talked about the ECE. There is the ATCOM. And as far as the ATCOM is concerned, we are supposed to do only the first five, 1.1 to 1.5 aspects, right from the how to respect a cadaver to what is it to be a patient and what is it to be a doctor and how to communicate. So these are aspects that we have to talk about. The MCI says that we need not actually, have any questions related to ATCOM in the summative exam, but they're saying it may not. So if some universities choose to ask a question related to ATCOM, it won't be wrong in a way. And then, of course, there are the electives. And all this is reinforced with the help of integration, skill training, and later on with clinical clerkship. All of us are aware of this. They're all out in the public domain. So even when it comes to my students and I talk to them, I tell them, just go to the MCI website and see the documents for yourself. So it is not that we have to hide things from a student. We have to not tell them so that let us see kitna maza aayega ki unko kitna aata hai dekhne mein. There is no need for us to do these things. It's all open. Let them read. Let them see what each and every document that we are reading, they are also reading. We are aware of the ATCOM module. Then there is the skills training, and in the whole curriculum, it is defined that the competencies where shows how or perform is marked. They're related to the skills to be developed by the Indian medical graduate. That is in the end. So in the case of P, that is performs, the number required to be performed also should be specified. And the skill labs pertaining to psychomotor, affective, and communication domains are also identified. All this will, is all worked out in a sequential manner. Even the skills training is there right from the first professional to the time that the student becomes an intern. So this is what our group, we hope that all of us together will be able to formulate that what is it that we need them to do. So what are the features? There is a greater emphasis on learner-centric approach, as I told you earlier also. Teaching learning methods are specified. There is active learning strategies. Didactic is much less, it's about 1/3. They are trying to put us into small groups so that, small group teaching is something that is advocated, and that is when we need to have there are people or departments where they'll say, oh, where is the manpower to do all this? But somewhere we need to break them up into groups and try and even use maybe peer teaching, and maybe that will work. And then of course you have the DOAP, that is demonstrate, observe, assist, and perform. And then there is the self-directed learning, along with it the assessment. No doubt assessment drives learning, so you would have to have formative, internal, and assessment and summative assessment. What is the assessment? It is involving many settings, many examiners. You have a logbook that is already there, and we are encouraging our students to write in the logbooks. There is the end of a particular program examinations which will be counted in a way in the internal assessment. And of course, there is the expert judgment based on qualitative assessment of the ATCOM and the ECA. There is the formative assessment, the foundation course, and the electives. We need to blueprint So there is a blueprinting grid where the topics are given and the levels also have to be decided. And what have they said as far as assessment is concerned? That application oriented questions should be there and MCQ should not be more than 20%. So this is as far as the assessment is concerned, and it is going sequentially. And it is 50% marks combined total and practicals have to pass, and not less than 40% in the theory and practicals separately. So assigned for the internal assessment. And internal assessments will be reflecting as a separate head this time. All of us are aware of this, but I'm just showing you all this again once more to reiterate that earlier what used to happen, a part of the viva of the practical used to be then be clubbed with the theory, but that is not so anymore. And you have the learners, they have to complete the logbook and complete in each phase of the training. So again, there is this assessment, which is a repeat, of course. You have the assessment program here, and this is what it says. Every biochemistry also 200 marks, 2 papers, and 100 mark practicals. And internal assessment marks will not be added to the university examinations and should be shown separately in the grade card. This all of us are aware of, but still I thought I'd reiterate it. As far as the facilitatory mechanisms are concerned, what did the MCI do for us? They had faculty development programs. We had the nodal and the regional centers established. We have the basic and advanced courses for the faculty development. There is a medical education unit strengthening. There we have many of the documents were just put into the public domain, and all of us, they are all open for us to read. And you have university and institutional committees made, and each one and each committee is answerable to the MCI, and on each institute's web page and web program, it has to be all specified. And of course you have the CISP since 2013, and this is our whole curriculum that is given to us, the undergraduate curriculum. And we have the volumes, you have the number, you have the competencies, there is the domain, then you have the knows how, shows how, so which is all identified as per Miller's pyramid. Then there is the whether it is core or not, and what is the teaching learning method that will be used. Suggested assessment method, would you use a skill based, would you have a practical class, would you do an OSPE, what would you do? And then of course whether there is a certification. Most of the time this will be blank, because the certification P is at a later stage. And of course, with whom will you integrate it, whether there will be a vertical integration or whether there will be a horizontal integration. And there are a lot of control mechanisms. I mean, the MCI is now not letting us just be or say that, okay, when the inspection happens, we will ask them for their timetable. They started right in the month of March, April, to ask us to upload the timetables and the submission of the specific learning objectives. There were committees at the college level. There was supervision by the university, and the implementation and the assessment plans, all this had to be sent to the universities. And there were curricular reviews every 5 years through standing mechanism, so that there is a curriculum governance. So what is curricular governance? Who is accountable? Who is responsible for the oversight of the curriculum? Who will support, enable, and facilitate the faculty to deliver the curriculum? Who will evaluate and provide necessary inputs that will enable course corrections and continuous improvements? So this is where, when people ask us questions, when people say put it into the public domain, all of us have to be vigilant and give our views to the people, so that these small things like the foundation course, if you feel 1 month at a stretch was fine, that's also okay. You can voice it, and everything can be said. So then this is the role distribution. You have the MCI, you have the guidelines, you have the rollout plans, the program evaluation guidelines, and the central committee, monitoring committee. In the university, you have an operative assessment plan, implementation plan as per context. Then there is the implementation committee. There is the university evaluation plan and the university monitoring committee. And individually colleges and faculty, there is that curriculum committee for local monitoring, and of course the medical education unit. So everywhere there is a role distribution for each and every one of us. And then of course this is the organogram for curricular governance. And then we have to derive the learning methods from the competencies. And this is what we've already gone through. So I'm just quickly reminding you of these objectives that we wrote and the different verbs that we used, so that we could we sort of slowly changed our questioning pattern, and also related to the action verbs. So learning also occurred using the action verbs, and the assessment also occurred using that. And then of course you have the objectives, which were then aligned to the teaching learning methods and which method you would use. And then the ascendancy of the competence, slowly from knows, say in our case, describe the main classes of lipid, to knows how will you interpret the results of the analytes, to shows how, where you can actually talk to a patient, counsel a patient on diet, and prescribe the appropriate therapy for various lipid profiles. And of course finally does is when he actually does the experiment and does a particular experiment and shows you. So this is how the whole curriculum or movement of competence has changed over time. And then this is the summary sheet that you would use for the lesson plan: number of learners, objectives of the session, primary teaching method used, advantage of this method, possible disadvantages, and faculty preparation required. So this, if each one of us, for each topic that we teach, have this summary sheet, things will fall into place and it will help us. All this is given to us and it is all there. And if we were only to use it judiciously, we will, where teaching learning methods, infrastructure required, student preparation required. Are you using a flipped classroom? Do you need the student to pre-learn and come to the class? All these are aspects that we can put down in this simple learning plan. And of course there is the assessment. So with this, we can take a break. And I've not been able to really see how many of you have joined. We have 44 people joining. And Dr. Bedi, would you like to say something in between, or should I just continue? Do we have any hands, or does anyone have anything to put in the chat? Would anyone like to say anything? I think everyone is muted. Okay, then I think I will continue, and maybe Dr. Bedi will join us a little later. But just stretch a bit, and if you have anything to,
I am very much there.
Okay.
Yes.
I would go on to talk about the SLOs, but before that, if there are any questions, or if anyone would like to comment.
Dr. Reema Kapoor, there are a number of yes, Dr. Reema, or you can also write the questions on the WhatsApp group. In case you are unable to unmute yourself, just write on the WhatsApp group. Hello? Yes, Dr. Rima, please speak.
Sir,
We
right
can't
now
hear.
I don't have any question right now. You can continue, sir.
Okay, you raised your hand. Okay.
Okay.
Ma'am, there are no hands.
Okay. All right. So we will continue. I just thought we'd, take a small break, and then we move on to the specific learning objectives. What we're going to do is break all of us into small groups, and each group is going to. We've already developed the SLOs, but we would want the groups to consolidate these SLOs. So this is the principle of education. When you are clear what you have to achieve at the end of the session, what the students will be able to do at the end of a learning period, which they could not do before, that is when we will have a specific learning objective in mind. And the tasks, the skills to be learned in a particular TL session, more in number, they should be precise, and they should be minimal acceptable level of performance expected is specified. So we have to specify this, but at the same time, when we write the SLOs now, there is no need for us to keep saying that at the end, in 1 hour's time, and make it very time dependent, because we know all this. And you need to talk about behavioral change as far as knowledge is concerned, feeling is concerned, and the psychomotor domains are concerned. And there has to be a common language for all. Think, plan, discuss. And there has to be a better communication without any ambiguity, and it helps in planning teaching learning sessions and assessment. The action verb is most important. All of us know this, and as far as the performance indicator also is concerned. And we need to use our verbs judiciously. So when you are thinking of just recall, we can just say enumerate, define, list, state, mention. When you want them to show understanding, we say describe, explain. And when we want them to use problem solving, we will say contrast, criticize, deduce, distinguish, relate. And of course, as far as the psychomotor is concerned, there will be so many aspects that we will have to ask them to do. So verbs that will be used were receiving, responding, and internalizing. So to listen attentively, to show awareness. When you respond is to communicate, to obey. And when you internalize, it will be to contribute, to cooperate, to participate, to maintain, to participate, and to practice, and to demonstrate a particular attitude or commitment. So this is what we will be using as far as the psychomotor is concerned. So the subject matter is important and the action verb is important. And then, of course, the conditions. Under which circumstances will they know? At the end of the first professional, or at the end of this lesson, the student should be able to, the first professional student should be able to. That is the way it should go. And we should also specify any restrictions which are imposed while carrying out the act. And of course, we can discern the data from the given data, from the diagram, using the chart provided, without any assistance, do this. And when you have to say the minimum level of performance or proficiency expected. So state at least 4 ways, or state any 3 major causes of a particular disease manifestation, omitting not more than 1 step. Tell us how you will give an IM injection. Accuracy of at least 90% and without causing hematoma. So these are the conditions or the criteria that you would like to give as far as the SLO is concerned. what are the problems in framing SLOs? We sometimes use a wrong verb. We just do things in isolation. We just sit and just finish our SLOs, at a table, and one single person does it without thinking of the alignment and integration, the content, the clinical relevance, and the competency. So this is the problem, and that is why all of us are here, like-minded people. I call ourselves. We are all people who have, this not just our students, at the bottom of our hearts, and plus we want to do things well. We want to do things properly, and that is the reason why we are here together for a common discussion, so that all of us can help each other in framing the SLOs, and not only framing the SLOs, to take this whole curriculum ahead, so that we discuss each and every part, right from the SDL to the ECE to everything, and any other problems that we may face. Remember that we could have false criteria, and you could have the tyranny of the trivia, it's called, where there is a temptation to become very, or a bit too specific about things. So you have the learning objectives, there are the activities, and then there is the assessment. This is how there has to be a proper alignment, and it could be, measured by all these assessment tools. And then, of course, there is the relevance. It has to be relevant to the health needs of the society, unequivocal. That means when we write an SLO, there has to be no two interpretations. It has to be very, very clear, feasible, possible to attain within given time and available resources. It should be observable, indicates the progress towards its attainment, and it should be measurable, provides tool to decide the extent to which it is achieved. And so we have the cognitive domain, which moves from knowledge to evaluation, and you have the different levels, like moves from knowledge to comprehension to problem solving. We have the psychomotor domain, which will move from perception to set to graded response to mechanism to complex overt response, adaptation, and origination. That means from imitation to practice to making it absolutely, just subconsciously you are able to carry out a particular technique. That is automatism. And then the affective domain. You have the receiving, the responding, the valuing, the organization, and characterization. That means you have the receiving, the responding, and the internalization of feelings. So that you're not thinking that this is what I have to ask the patient, it just comes naturally to you. So what are the role of educational objectives? So that we have focused teaching, we have selection of an appropriate method, there is better evaluation programs, there is due weightage given and the marking system is decided, and you have given clear-cut directions to the students. And once more, I show you this verbs list for all the domains that it can be used as far as the verbs are concerned. And so this is how we have written our SLOs, which are all out in the public domain, and which says at the end of the lecture session, the first MBBS student shall be able to, and we write our SLO. So with that, thank you. I would like to place here on record the help of my dear friend Nima Rege from pharmacology, because we've conducted these sessions, in the past together, and these are slides that both of us have sat together and made. So this is sort of both Nima's and mine. Of course, it's nothing out of the box or anything, but we have collated the slides together. So thank you for that, and I place on record Nima's contribution also to this. And over to you, Dr. Bedi.
Yes, ma'am.
And if there's anything that anyone wants to ask, I am open to answer. And I think we'll have to stop sharing my
You can keep the first slide of the PPT, or you can.
All right. Okay.
Yes.
Yeah.
Yes. Then yes. Any hands? Anyone? Or Dr.
Actually,
Pragna, Dr.
Yeah, we would like all of you to tell us what is it that you expect from this course.
Dr. Milav Bhaskar. Dr. Milav, you are self-muted.
Good evening, everyone.
Good
Am I
evening.
audible?
Yes.
Yes, you are.
Yes.
Madam, the question right now I have is that we have discussed about the SLOs and making. Now the question is that once we create the SLOs, the problem comes around at the teaching learning method, because we are used to, most of the time we are used to didactic lectures. So
Yes.
what happens is that once we decide and once we create the SLOs, it comes to the problem that which particular type of teaching learning method we have to go through. So can we add multiple different types of teaching learning method, like peer teaching, small group teaching, or single didactic lecture is also only one method has to be gone through SLO?
No, no, no. You can put multiple methods. And in fact, I would like to just show you here. I mean, I do have, we were not going to take anything on on interactive teaching, but I will just show you a few slides that I have. I had prepared them. So I'll just show you what let me see. See, you can integrate and you can put 2-3 of these methods together. Can you see my slide? Can you see my yeah? See,
Yes, ma'am.
in the large classroom itself, I'm glad you brought this up. Thank you for this. Because I don't think we are going to talk about interactive teaching, but I could take a session if you want me to. But there is just simple think, pair, share that you can do in a class. So all these are concept tests, jigsaw, quick things, 1-minute paper, question of the day. All these are small techniques that we can use in the classroom. I understand that all of us, because of the paucity of time, all of us have to, people are just saying, abhi lecture le lo, abhi online class le lo. So when we are taking that online class, what we need to do is we can use these techniques. We can break up the students into small groups. All these platforms, the Zoom platform and the Google Classroom, everywhere, we are able to break them up into groups. Do that, and that will help. And that can be specified. Each teacher, see, and each teacher, I feel, basically has their own personal comfort level. I may be very comfortable doing a role play. I'm an extrovert. I'm that kind of a person. I'm just flamboyant. So I enjoy doing such things. But there may be someone who is an excellent teacher, but could be an introvert. And you may feel a little awkward doing a role play in front of, 200 students. So it is up to the teacher also to understand what is their comfort level and take it forward. Have I answered your question enough? And then you have to specify that in your learn plan, in your plan that I talked about. Okay.
Thank you, ma'am. Yes, ma'am.
Thank you. Anyone else?
Dr. Rohini Bhadre, ma'am, you.
Yes,
Yes.
I expect from this CBME that all of us, since we are from different universities, could come onto a common platform for this our subject. So that is what I expect. We could have a common platform and which could in forming these SLOs and each one has a separate SLO. So if we could come together and have a common platform where we could bring all our
Yes.
SLOs.
And that is what exactly Dr. Bedi is going to do on Friday. He is going to, we are going to break up into groups, and I think we are, sitting and working on that. And on Friday, I think Dr. Bedi, you will do the needful.
Yes, I will be sharing the groups, and
Yes.
also, as Dr. Rohini has said, that we can share our problems, and this group will continue even after the 3 months are over. So you can continuously share your problems, and maybe go ahead. Sky is the limit of cooperation.
Yes. Yes.
Yes, that
So
shouldn't
true.
be a problem. Yes.
And the whole, should we also, Dr. Bedi, let them know about how we want to go about things, and at each level, we will also share our timetable with you. We have made a timetable, and that timetable also will be shared with all of you.
Yes.
And
Dr.
on
Anandita Banerjee.
hello.
Yes. Who is speaking? Yes, Dr. Anandita. Please unmute yourself. Oh, she has lowered her hands. I think she has written on the chat. Please recap CBME biochemistry hours. How can SLO sessions be utilized?
Okay.
I think the answer to this question will come in the coming days.
Please recap CBME biochemistry hours. How can SDL sessions be utilized? Yes, SDL, we are going to have a special session on SDL, and we will let you know how it can be, how they have to be fruitfully utilized, because we have to remember that we are talking to adults and we have to give them work to do, and that is what we will let you know. I don't have the hours here, but I will definitely let you know the next time it's there. They are much lesser than biochemistry and physiology. That is why when the timetable was made, also biochemistry has some lesser number of hours.
Yes.
Ma'am, I have one question.
Yes.
Maybe it is not related right now, but what I think actually is when the students they are in the first prof, they like
Hmm.
anatomy and physiology more, but they like matlab biochemistry they give less weightage because they think they are more of the cycles, and they don't know that how to use how they will be utilizing it later on in various studies. So what should be the specific learning objective in this case when we are teaching them the various cycles, like from the various metabolisms we have the long cycles and it is very difficult to learn them all.
Actually, in competency-based curriculum, there is no need for them to know this whole cycle anymore. What we have
Hmm.
to do is we have to move it. I mean, when for example, if I'm going to teach the TCA, I don't
Hmm.
show them the TCA straight away. I
Hmm.
tell them that this is the cycle, which is it is sort of funneling
Hmm.
everything, and we have to tell them about the fact that when anything goes wrong with so many cycles, there are so many wrongs happening, right?
Yes.
The clinical manifestations, the deficiency manifestations, etc. So
Hmm.
you have to start with that. So then they see the relevance. I never
Okay.
start straight away with any topic. I always say, why are you learning this? Why are you? Why are we doing even teaching you the cell now also, even though you have learned it in the sixth standard?
Yes.
What are the aspects that we are now altering and changing, because the world is now moving into not just that cell, but it is also moving into biomarkers, molecular biology, and all this, and this is what is changing. And I will also now use the COVID, the virus, and the
Hmm.
coronavirus, and tell them about how things have changed. So
Okay.
make things relevant. I think all of us must read the newspaper every day. And there are so many episodes, there are so many small things that keep on cropping up, which are so biochemical, so to say. Pick that up and show
Okay.
it to them and say, look, this is what happened in this case. I think
Okay. Thank you, ma'am.
I hope I've answered your question.
Yes, ma'am. Yes, ma'am. Hmm.
Thank you. We have
Okay.
one
Thank you.
from Dr. Suchitra, who's saying that she would like to know about how to integrate, and Dr. Jyoti Batra is going to take one session on integration. So we hope that we will be able to clarify all your doubts about how to integrate in that session.
Okay.
Dr. Vidya Patil. Dr. Vidya, please unmute yourself.
Yes, sir. Yes, sir. Thank you, sir. Ma'am, thank you so much for recapping us, taking us through back to the CBME curriculum and framing of SLOs. So what I expect from this is, like, we have been implementing this from last 1 year, and we have been facing so many challenges. So if we could know, sir, like how we are going about this session, so each one of us can come out with those challenges, and at those points it could be addressed appropriately, so that we could get take out an answer for each of the challenges faced. Thank
Okay,
you, sir.
what we will do is, I think with the permission of Dr. Bedi, I think on Wednesday we will put up the groups and the timetable. And Dr. Bedi, so on Friday, the people come back with a little more focus. Is that all right, Dr.
Okay.
Bedi?
Yes, ma'am.
Okay, so on Wednesday, whatever we have prepared, we will share with you on Google Classroom and also on the WhatsApp, the
Yes,
timetable
okay.
and the groups. Okay,
Yes,
so
ma'am. Yes, ma'am.
we
Sure.
expect in each of the groups that are made, we feel that you can choose a leader if you want, or those groups we will be giving you the email IDs and the phone numbers. So
Okay.
you can make your own WhatsApp group, each group. We have about 90
Okay.
participants, so we will break you all up into 10 groups for the 10 competencies, and that is how we will work.
Okay. Okay.
And
Thank
each
you, ma'am. Thank
competency
you.
we will discuss every day. One competency one day, with their
Okay.
SLOs, with the ECE, with the SDL, and everything.
Mm-hmm.
Uh,
Okay.
but people have to do homework and come.
Yeah, that's why, madam, because we have been having so many challenges throughout.
Yeah. So
So
in one
it would be better
hour,
addressed.
it's not going to be possible.
Yes, ma'am. Thank you. Thank you, sir.
Yeah. Yeah. It'll
Thank
be
you, ma'am.
fun.
Thank you.
Yeah.
Yeah, yes, ma'am. Sure.
What else? Anyone
Dr.
else wants to?
Dr. Suganti on chat.
I cannot see the question.
She says, thank you for this platform for biochemists. We are ready to form and had made SLOs, but the assessment for 200 marks are not still clear. How to go about the SLO really achieve the essence of reading biochemistry in first year.
Yes. See, the assessment for 200 marks, the university has already decided. We've got all the program there. So, we can share what our university is doing with you. It is all in public domain. So please go, just look out for 3-4 universities, and you will see how the 200 marks are divided. There are 2 papers, 100 mark each, and there are 2 sections, and MCQs will be 20 marks, and 80 marks ka paper. And out of those 80 marks, there will be some LAQs and some SAQs. And in the SAQs, there will be some which will be related to the ECE, some will be applied questions, and some will be one question our university has decided to do on ATCOM. So that is the way it will go. And how will we really achieve the sense of reading biochemistry in first year is we have to motivate them, and we have to tell them about the relevance. I think, at first chance, sometime, we have to take them to our labs. We are such faceless creatures, I tell you. सब कुछ लोगों को ग्लूकोज लेवल हर घर के आदमी का ग्लूकोज लेवल देखा है, that report, but none of those poor students know that it is the biochemistry department that is dishing out that report, and how it is doing it. Look at the machines, look at how the quality assurance and the quality control that is happening. And it is the task that is done by the biochemist is humongous, and that is what we have to tell them. And this biochemistry is what is going to take them from pathology to pharmacology to medicine, and that is where all of us will help. Yeah, is that fine, Suganti?
Yes, ma'am. Yes, ma'am. Thank you, ma'am. Actually, we are trying to do the thing, but still, as a teacher, we are facing a lot of challenges. Might be that forum can be discussed here. It will give a way for us to have a new other modes of approaches.
Yes, true. We will do that.
Yes, thank you, ma'am.
Dr. Jyoti Batra.
Yes, sir.
I think you.
Good evening, sir.
Good evening. Yes, you would like to make a comment? You have.
I can only say one thing. Ma'am has started with a bang, very commendable presentation, and given a lot of benchmarks to all of us. Thank you so much, ma'am, for starting such an informative talk. We would like to come to your level. Thank you so much, ma'am.
Welcome. We will, I think, introduce ourselves now. Is that okay, Dr. Bedi? And then we can, close the session, I think, because we're already a little past. I am Sucheta Dandikar, and I used to be head of biochemistry at KEM GS Medical College, Mumbai, and I'm now professor of biochemistry at the IRAS Lucknow Medical College. And needless to say, biochemistry and medical education are both very close to my heart, and I just love what I do, and that is the reason why I'm here, hoping to learn from all of you too. So with that, over to Nibriti.
Hello, I'm Nibriti Das, Dr. Nibriti Das. So I retired from AIIMS as a professor of biochemistry after serving AIIMS for 30 years at 2014. And then I joined Nati Multi Super Speciality Hospital, Mathura, where I had been the director of lab services, head of the biochemistry and laboratory medicine, and additional dean. And I have got lots of interest in medical education. At AIIMS, we were the foundation faculty for the CMET of AIIMS, where we were sent for the training to Dundee, Scotland in medical education. In between, I have worked at Arabian Gulf University, which is a problem-based totally problem-based school, so I have an exposure for this case-based learning and those type of things. So I'm really feeling very happy that it is the full fraternity of teachers. We are together to learn something, to discuss something, and really to find out a new dimension in the teaching and learning of biochemistry. And one of the question was very interesting that I loved it. In my 30 years, I never taught any metabolism as a cycle. I used to tell my students, if I look at those cycle, I will forget my biochemistry. So, but everything was taught, but not exactly as a cycle and so on and so forth. So they are not scared therefore. So I think as much as possible, cycles are not to be taught as cycles, rather than maybe the which is the step which consumes energy, which are the steps where the regulation is there. Like that, ultimately you land up telling all the cycle, but not the way students get scared of. I think there is a so very nice meeting all of you, and Dr. Suchita, you have really set up the mood of the.
Thank you, madam. Such a pleasure also learning from you. And now we have Jyoti.
Good evening, everyone. I am Dr. Jyoti Batra. I am associated with Santosh Deemed to be University. I am professor of biochemistry and dean research there. It's a wonderful forum. I am associated with such senior faculties and co-learners here. I think I'm looking forward to a lot of learning from all of our co-learners. So thank you for being here, and thank you, Dr. Sanjay Bedi sir, for keeping us together. Thank you so much.
Thank you,
Sabia,
Dr.
Dr. Sabia? Saiba? Dr. Saiba?
I think Saiba is, I just received a message on group that
yes, sir.
Okay.
She's just returning from COVID lab, sir.
Okay.
Yes.
Pragna?
Hi, good evening, everyone. I'm Dr. Pragna Rao. I'm the former dean and former professor and head of the Department of Biochemistry at Kasturba Medical College, Manipal. Presently, I'm still with the Manipal group, but I work for providing digital content for medical students. I was also the head of the medical education unit at KMC Manipal. And in my experience of conducting workshops, I always used to have at least one person get up and say, why do we teach PCI cycle to our medical students? And as a medical educationist and as a biochemist, I always used to give the same reply which Dr. Sucheta and Dr. Nibriti have given. That is, it's not about the cycle, it's about the application for medical sciences. So I hope that is one question that we can answer fruitfully on this eminent panel of 45 or 90 odd people who have signed up for this. That how do we give the clinical focus? How do we give the medical relevance of biochemistry? Thank you.
Dr. Rohini?
Yeah, good evening, everyone. I'm Dr. Rohini Bhadre, professor at the KJ Somaya Medical College. I'm also the MEU coordinator. And as Dandekar madam said, because Dandekar madam is my teacher, where right from biochemistry to medical education, I have been her student. And I have also been a GSMC FAMER, where she was my teacher, and now I'm also a faculty member at GSMC FAMER. And as Dandekar madam and Nibriti madam said, I also never teach these cycles as a part of cycle. It has always been in a different way. So cycles, biochemistry is not only cycles. It is, the relevance of these cycles. So of how biochemistry is relevant to the whole medical fraternity. That is how I start with it. And I try to make my biochemistry very interesting. And I'm also a participant of this CBME. So I'm going to be a co-learner along with you. Thank you.
Thank you so much, Rohini. So now over to, can we close this? Sanjay, over to you for the last words.
Well, thank you, Sucheta ma'am, and all the faculty and all the participants for being here. And as I said, we pray to Almighty that the objective with which this course has been created, it is achieved, and in the whole interconnectivity of medical education, we achieve certain goals which we want to achieve. Thank you.
Thank you so much. Thank you. Good night, everyone.
Good night. Thank you.
Bye-bye.
Good night.